Hi, my name is Kayla Reacano, and for my Unit 4 project, I did an ankle retinaculum repair post-surgery rehab. And to start off, the mechanism of injury is when the tendon repeatedly subluxes, causing it to overwork, trying to protect the ankle, leading to the retinaculum to tear, which then allows the tendon to slip from the groove. So, some symptoms of this injury is the peroneal tendon moving behind the ankle, also having some sharp pain around the ankle when the foot is pointed inversion, some swelling and tenderness. Here's the step by step during the surgery. The first step is the surgeon makes an incision along the back of the ankle and the lower edge of the fibula. Then, after that, the surgeon can now see where the retinaculum is torn. After that, the surgeon then uses a burr to create a trowel through along the fibula bone next to the original attachment of the retinaculum, and after that, the torn retinaculum is pulled into the trowel and is sutured in place. And then the surgeon closes the incision with stitches. The approximate time to perform this is an hour to an hour and a half. For our phases, we have 6 phases. The first two are the immediate post-op. Phase 3 is late post-op. Phase 4 is transitional. Phase 5 is advanced post-op. And phase 6 is early to unrestricted return to sport. For the first phase, which is the immediate post-op, it occurs at the first 2 weeks after the surgery. The rehab goals for this phase is to protect the repair, maintain strength of the hip, knee, and core, manage swelling with elevation, and for weight bearing, it's going to be non weight bearing with crutches in a splint or cast. And for intervention, or also in other words, just like what you're going to do throughout these weeks, is working on range of motion and mobility. So a supine passive hamstring stretch is a good one, and then also just strengthening, so quad stretches, straight leg raise, and hip adduction. So the objective to this phase is to decrease pain and swelling. Next up, we have the second phase, which occurs at 2 to 4 weeks after the surgery. The rehab goals for this phase is to again protect the repair, but also reduce pain and swelling and improve scar mobility. For weight bearing, we will start to begin partial weight bearing on crutches in a boot or splint. For intervention, you're still going to be doing the same things as phase 1, so working on range of motion and strengthening, but also with an addition of dorsiflexion and plantar flexion stretches if it's stiff from the boot, and also adding seated heel and toe raises to strengthen. The objective of this phase is to decrease pain and swelling again. Next up, we have the third phase, which occurs at 48 weeks after the surgery. The rehab goals for this phase is to, again, protect the repair but also progress into more strengthening and avoid post exercise pain and swelling. For weight bearing, we're going to continue partial weight bearing up until week 6, then proceed to full weight bearing. The intervention, you're still going to be doing the same things from phases 1 through 2, but with an addition of beginning inversion and eversion with strengthening after week 6. And then with cardio, we're going to start doing stationary bike and add more resistance to strengthening exercises. And then we're also going to initiate isometric eversion exercises after week 6. The objective of this phase is to have no swelling after activity and have more progressed range of motion and have good weight bearing and good shoes. Next up, we have the fourth phase, which occurs at 9 to 12 weeks after the surgery. The rehab goals for this phase is to increase strength and continue with ankle range of motion if it's limited, also improve balance and avoid pain and swelling after the activity. And for weight bearing, at this point, we're going to be walking, but we're going to be training that limp. For our intervention, still going to be doing the same things from phases 1 through 3 with an addition of swimming, treadmill walking, and then more strengthening. So some exercises is Romanian deadlift, leg press machine, and hamstring curl machine. For proprioception, we're gonna have single limb balance or a double limb balance on an uneven surface. The objective of this phase is to have full ankle range of motion and strength, having no swelling or pain after activity, and a normal gait training. For phase 5, this occurs at 3 to 6 months after the surgery. The rehab goals is to have full strength and range of motion of the ankle and avoid pain or swelling after activity, and have good tolerance with progression to plyometrics and agility training. We're still going to be doing the same things as phases 1 through 4, but with an addition of more strength in the knee. So, seated calf machine, lunges, and for cardio, we're going to be adding elliptical and a stair climber. And for running, we're going to have interval walking and then slowly progress into jogging. And then we're also going to add plyometrics. Our objective is to have good tolerance and performance with plyometrics, agility, and training. Lastly, for phase 6, which occurs at 6 or over months, our rehab goals is to continue strengthening and proprioceptive exercises, performance with sport-specific drills, and safely progress to full sport. We're going to be doing the same things from phases 3 to 5 with an addition of sport-specific training and conditioning. We have some functional tests for return to sport. Some tests are a time lateral step down, a single leg hop for distance or time, and also a single leg triple hop for distance. The objective of this phase is to have good tolerance and performance with plyometrics, agility, and training. And so, yeah.